Everybody. Welcome to the Femtech Summit. Again, we're going live, and I just want to give you my special thank you for everybody who's actually joining us live today. So that support means so much to me. So I really appreciate that. Or you'll have opportunities to watch it later too. So beautiful. I want to invite you to hear today from another fabulous guest, Dr. Evelyn Hecht, who is the founder of Pelvic Sense. It is an online pelvic healing home program helping women reduce chronic pelvic pain in 3 months concurrently with medical care. As a master clinician of pelvic physical therapy for 25 years and a certified psychosocial chronic pain rehabilitation practitioner, Evelyn has dedicated her illustrious career to helping women heal from chronic pelvic pain and gain optimal bladder, bowel, sexual, and core stability function. So Pelvic Sense, as we mentioned, Evelyn Hecht is the founder of it, has a biopsychosocial healing approach that incorporates the biological, psychological, and social factors which drive up or dial down our pain experience. The 3-month program reduces central sensitization, a primary driver for chronic pelvic pain. And Evelyn is a regular speaker and writer on women's health topic and educates medical colleagues about improving patients' health through technology concurrently with their care. Her strong empathy for women's pelvic health reverberates throughout her endeavors. She's open to collaborating and engaging in research to better women's health through Femtech. Well, I want to say Evelyn's mission to help women with their pelvic pain, pelvic health issues is so close to my heart. So I cannot wait to invite her over and let's get the conversation starting. Welcome, Evelyn.
Thank you.
Such a pleasure to have you. So, I would love to start with your own story. And how did you get into that whole specialty field of pelvic physical therapy? What inspired you?
Well, thank you for that question. Really, in a nutshell, I was listening to my patients. That drove me into pelvic physical therapy. So when I started as a young physical therapist in a large New York hospital, we saw a lot of international patients, and I speak different languages because I lived abroad in my young girl life with my family, and so I would get a lot of them, and they would invariably ask me questions like. And this was in very hushed, embarrassed tones, like, Evelyn, I can't have sex with my husband. It's too painful. How can I be intimate? How can our relationship last? And how can I even give birth if I'm having this type of pain? Do you know anything about it? Other people would ask, Evelyn, I'm going to the bathroom like 15, 16 times a day, too many times because I have this urgency that I feel that I have to go. And I'm so embarrassed by it. I don't go out with my girlfriends to have coffee because I feel I have to leave every 5 or 10 minutes, and other related questions. So I went out as my young therapy to talk with my colleagues, and I asked them, do you get these questions and how do you handle it? Because it was sort of new for me. And they looked at me with blank stares and they said, Evelyn, we've never been asked those questions. So I thought, wow, there must be something about me that elicits this type of confidence. And maybe I should look into the pelvic floor. As our pelvic physical therapists, we really didn't learn much at 27 years ago now, in our schools about the details of pelvic floor function. And I thought, well, I'm getting so many questions and there are muscles there, right? There's nerves, there's function. The pelvic floor has elimination functions. It has intimacy functions and core stability functions. So shouldn't there be something that we as pelvic physical therapists or as a physical therapist can we do? So that's how I got involved in the field. And then I decided to open up a pelvic physical therapy practice 25 years ago, and now have treated up to 15,000 women in my years. Yeah.
Yeah, no, this is so impressive. And also, you're the pioneer because that many years ago, like you said, hey, those questions are not addressed at all. Now we may be starting, right? But so I would just want to honor you for that. That is so valuable and such a great contribution. And I know so many women are listening and they know either themselves or know somebody else who is suffering from pelvic floor dysfunction. And that can really affect the entire life of a woman and her family. So thank you for that again. And, so you ran that successful physical therapy practice in New York for 25 years. You taught pelvic health at universities, mentored all the therapists, and yet you decided to pivot again and actually go into a femtech-based business model. So what inspired you to make that change?
Well, there are three reasons. One is we weren't reaching the majority of women from middle and lower income families. My Upper East Side boutique practice, rent was expensive, therapists to hire were expensive, dealing with insurance companies. Unless you were a wealthy woman or had top tier health insurance, we weren't able to treat you. So I thought I needed a place that I could reach more women, number one. Number two, midway, about 10 or 12 years into my practice, research had discovered the modern pain of science, the modern science of pain, and how neuroplasticity can help with healing. So I started to implement that with my practice. And prior to implementing knowledge about pain science and what is neuroplasticity, I had a typical biomedical approach where I was the therapist that gave manual treatments and taught movement exercises to my patients. The patient was a recipient of care. But with this knowledge about pain science and neuroplasticity, the patient now becomes more of an active participant in their self-healing. And when I learned that this was a possibility and implemented that with my patients, instead of maybe 60% of people of my patients getting better and 30 to 40% running to 50, 60 different doctors, different specialists, and getting injections and getting surgeries and interested in implants, but they're still having pain. Now we started implementing pain neuroscience, and that was a jump in our patient experience of healing, about 80 to 90%. We're not experts. We're not like the only one, but we saw that that was a big, big push, a big enhancement. And so a lot of this work can be taught online. We were doing more, physical therapy became less of intense manual movement work, which is part of it. But it became more of educational knowledge, science information. So 80% of my work was more education. So I thought, well, why can't this be put in a way, in a platform that people from lower and middle income, or those people that can't even go to a pelvic physical therapist because they can't find one, or because there's a long waiting list, why can't they learn this now? And the third reason was that I thought that Femtech as a platform would reach more women. When you're diagnosed, which thank God there are more and more doctors who are aware of pelvic issues and referring to pelvic physical therapists. But if you are now referred, and a lot of hospitals have good pelvic physical therapy practices, but there's a waiting list of 3 or 4 months. So you see a doctor, you get the diagnosis, this is your opportunity to get better, but you can't get in. And when you can't get in, and then you can't see the same therapist regularly because of the huge waiting list, that's unacceptable. So those are the 3 reasons why I pivoted.
Yes, yeah, and you're mentioning issues that are right now. I feel like women taking charge of technology, women who are doctors, who are scientists, who are entrepreneurs at the same time, are taking charge of technology and converting it into a vehicle for healthcare for women that is more accessible. Right? Accessible right away, that also teaches us to connect with the body rather than being that passive recipient. So I think that thank you for mentioning all this, because we want in this summit, we want to bring that understanding that this new movement is happening, and patients are going to be so much more empowered, and that's so you're a big part of it. I really appreciate that. So well, you mentioned neuroplasticity, and I wonder, a lot of our viewers are wondering, like, what is that and how can it help me?
Okay, so neuroplasticity. So it comes from two words, neuro and plasticity. So neuro is related to the brain cells, your neurons. Also the spinal neurons, the spine cells. So that's that relationship. Neuron is the brain and spine neurons, the cells. And then plasticity is the ability for them to shift, for them to be plastic, for them to change, to learn new behaviors, to learn new patterns. How cool is that? And we deal with neuroplasticity. All of us do. If we learn a new language, if we want to pick up the sport pickleball, if we want to learn how to paint, right? So it's not that we know snap how to do it. It takes learning the structure, how to take a brush in your hand, what colors to use, what colors mix to go from red to purple. It's a learning process. So neuroplasticity is, in our pain healing world, means the ability for your brain and nervous system to learn a new pattern, healthier techniques that you implement to change its old faulty hamster in a wheel, spinning the same old pattern over and over and over again, taking that pattern and making a new one, and then practicing the new pattern over a period of time. It is not within a day, and it's not within 3 weeks. It's a long period of time. 3 months to 4 months is what I'm finding. We practice that pattern to shift the way we feel, because what pain science is basically telling us is this: a person in chronic pelvic pain or any kind of chronic pain over time has now developed a super sensitive nervous and immune system. That super sensitive nervous and immune system is now more sensitive to threat because it wants to protect you. Our body, our brain, and our nervous system and our immune system is all about protecting us and keeping us safe. So if our oversensitive nervous system is super sensitive to threats. Now, threats can be emotional. I'm never going to get better. Or psychological. My relationship with my husband is doomed. Or social. I wasn't invited to a friend's gathering. All these are considered threats to the nervous and immune system. And the job of the nervous and immune system is to send this information, because it's information now, to the brain. And the brain says, oh, that's information. Do I decide whether or not I send her signals of distress? Because that makes her move. That tells her to go do something about it. So typically the brain will send signals of pain, or for women with urgency, that's urge sensation. So it sends signals of distress to tell you that you're not safe, something's not right, and you need to go to a doctor or do something about it. So neuroplasticity means that the ability that you can now implement less threatening information. So for example, instead of waking up in the morning and maybe when you first become conscious, instead of going to that, oh no, what's my day going to be like, in a negative way, which is considered a threat, you say, I've learned that that's a threat. So what can I do instead? Let me picture a person who I love. Let me look at their face in my mind's eye. Look at their face in my mind's eye, and let me send them love. Or let me just be conscious of, do I hear some bird outside my window? Or if my cat or dog, because they usually do when you first start to wake up, they want to come up and get their cuddles. Let me focus on that for the few moments. Focus on the smell of the fur, on the sound of the breathing, on the welcoming I'm receiving. Those are all considered tiny but very helpful, non-threatening activities. So we're going to use the skill of neuroplasticity to create a new pattern, to unlearn that old hamster wheel in a loop: pain, distress, threat, pain, distress, threat, and calming and soothing for the brain to send more of those soothing chemicals to your body.
Beautiful. Yeah. And so how does it specifically apply to women who are suffering from chronic pelvic pain? And why is neuroplasticity and that self-care that's involved with, how would you say that? Redoing the pathways in the brain, right? How does that in particular affects and helps women with chronic pelvic pain?
Well, it's interesting. The self-care for any pain is helpful. So it doesn't have to be just pelvic pain. Yeah. But I will mention something very interesting about pelvis. the pelvis is your first body's natural defense mechanism. So there was a film being showed, and some subjects, women were volunteered to look at a film, and there were some scary bits within the film. And they had surface electrodes, little small on their skin electrodes, measuring the electrical activity on their shoulders, their inner thighs, the pelvic floor, lower back. When the scary bits came up, the first reaction to the scare was the pelvic floor tensing. So the pelvic floor is like a mirror of your state of mind. So if you are soothing yourself, your pelvic floor gets that signal of things are good. It doesn't tighten up and tense up. So it's in terms of, for the pelvic pain patient, there's lots of techniques of self-care that helps the whole pelvic and the whole pain issue, but it also helps the pelvic issue specifically by lowering its tension. Because not only does the brain send signals of pain and distress, urge, it also tells the muscles of the pelvic area. So it's pelvic floor, your deep butt muscles, your hip rotator muscles, lower abdominals, all of those are told to guard as a form of protection. So that is part of the process, is understanding, well, why does my body feel this way? Oh, I understand. It's my system has gotten overprotective. Okay, that's nice. But now what can I do? You have so much you can do. And it's not like sitting on a rock in India for like 8 hours. It's really doing something small throughout your day, tiny things that soothe.
Beautiful. Okay, so you are the founder of Pelvic Sense, and you exactly helping women to start to undo those threatening, patterns, right? So
Yes.
How does it work?
Okay, so Pelvic Sense is based on my 25 years, really the last 12, of how do patients get better. And it's based on how can I incorporate teaching a person about pain science without it being overwhelmed. Because most people in pain, our brains can't focus too heavily on too intense things, but it's done in a way that's acceptable, understood. So it's an online pelvic healing home program that's going to teach you about the science of pain and all the evidence for self-care. Christian Neff's self-compassion, or James Pennebaker, expressive journaling, a wide variety of self-soothing techniques, gratitude. The program has many, many downloads, 50 positive affirmations. You can choose 1 to 3 every day and just say them to yourself. And what's the science behind that? So it's going to present you with knowledge. It's called Learn. It's also going to present you with something called Rewire. Part of the drivers for chronic pain, chronic pelvic pain, is an overly sensitive nervous system and a hyper helicopter parent type brain. So we want to inputs more of that, eliciting the relaxation response. We want to soothe, we want to calm, we want to elevate the alpha brain waves within the brain to allow the brain to sense that she is safe. You are safe. My body is safe. I don't have to send her the signals of pain. So the second part of Pelvic Sense is Rewire, a soothing, calming, active work that you practice. You listen to, it's audio guides with music. I guide you in a very calm voice. This is not a fast-paced. And the third portion is Move. Not only is it important to learn about pain, where it's coming from, what can I do to reverse it, and the exercise of mind work to help soothe myself. It's also want to help your body and brain connect the body movement as being safe. So guided breath work, diaphragmatic breathing, which is a deep inhalation, which lowers the diaphragm as you inhale, which also lowers the pelvic floor, which I know you've learned from another one of your presenters. So we're incorporating movement of breath to physically move the pelvic floor and get out of its holding upward tension points. And movement incorporates all kinds of mindful movement. So it's not just, hey, just move your leg there, move your leg there. It's about, can I sense the stretching in my inner thighs? Am I lowering that sensitivity of my nervous system to move? This is what we're really doing. It's all about down regulating the nervous and immune system to allow the body to move easier. And then the brain as well gets sparked in the cells, like in the brain neurons, like, oh, movement is safe. So there are lots and lots of different techniques. So I incorporate that. Okay. And yes, that's what Pelvic Sense is.
Yeah, that's beautiful. So it's a really kind of full spectrum experience where you go through different steps to really rewire the relationship with your own body.
Exactly. I love
And
that.
the mind.
Rewire the relationship with your own body. Oh my God, that's beautiful. Thank you.
Okay, no, it's very inspiring. So, well, I do want to ask, so who would be the woman that is the best candidate to explore pelvic sense?
Well, what we've learned is that any pain a person experiences, of course, they've gone to their medical doctors. I love medical doctors because if you need medicines as a bridge while you're trying to heal yourself, you take it. If you have endometriosis and you need to have the surgery, you do it. But what we want to treat are the sort of the remnants of this type of pain that is longer than 4 or 5 months. Anything over 4 to 5 months that is not driven by a medical cause, like a massive immune system problem or cancer or, an infection. Anything that's, many women have gone to a lot of specialists and they have all these tests and these tests are negative. And the doctor, really hasn't learned in their medical school what else can a person do. They just ruled out this is not an inflammation or a UTI. So then what do you do? So this is a type of program that women with all kinds of chronic pelvic distress, while they're working with their pelvic physical therapist, while they're getting their doctor care, they can start to do. Why not? It's affordable. It is something you can do on your own at home. I ask people to do just 20 minutes of this 3 days a week, not every day, an hour a day. It's minimum because it's a practice. It's a repetition of this knowledge and implementation of the skills of soothing, which doesn't happen overnight.
Okay, so how long does it take to actually implement those changes in the body?
Yes. So I would love to give everybody a definite answer. And that's really hard to do. So, but what I have seen, and I'm noticing in research as well, it takes about 3 months for a skill that you want to learn to really become sort of automatic. So I always ask people, give yourself 3 months. Now, our mindset is, what? 3 months? No, because I want it tomorrow. But that doesn't work like that. We have a pattern that without realizing it and without any fault of our own, it's the natural body's and brain's pattern of overprotectiveness. We've learned that. All kinds of reasons why we have developed that. Doesn't mean we're stuck with that, but we can become unstuck with practice. So I always ask people to give this at least 3 months of 20 minutes, 3 days a week. And I've seen a lot of my patients, for sure with patients, because of my therapeutic alliance with them, they got better faster because of that therapeutic alliance. And it's a placebo effect, and that's extremely important. And then, so with my members who I don't even meet, I speak with them we communicate by email mostly. They're letting me know, like by the end of that 3rd month, they're noticing less pelvic anxiety because they're not as fearful about where is pain, what is it, where does it come from? They understand where it comes from, and they're understanding that they also started to feel less of their symptoms. Some people have a drastic reduction of symptoms, but it's not for everybody. It's meaning in terms of that time frame. So I always ask people to do this work, and if you notice or you're measuring any changes in symptoms and it's for the better, then I would do it for another period, another 2 or 3 months. Like, keep going. You're healing. That's good.
Yes, it's not always all or nothing. I think that's very important. We're not going into some, ideal goal of achieving perfect health, in 3 months. But if you think about it, most people get worse over time. So unless you change that and start to implement changes, you probably will be getting worse. And so even just a gradual improvement is huge.
Absolutely. Well said, Monica.
Yeah, I always try to, remind people that it's such an
Yes.
important thing to remember. But I'm also curious, if a woman has been, for example, struggling with PCOS, or you mentioned endometriosis, maybe she is looking for non-surgical or non-medication approaches. Would you invite her also to explore pelvic sense?
Absolutely, because I mean, I did mention endometriosis because if it is a diagnosis and there is endometrial tissue that needs to be removed, certainly removing that tissue is as important. But part of the other process, because I've seen women with endometriosis that had surgery that are still in pain,
Yes.
and now we understand why. Now we understand why. It's because their nervous system and brain has gotten super protective around that area. You know, maybe obviously they've had women with endo have had period pain since they started having their periods at age, whatever, 11, 12, 13. So there's been years of having that area be in super overprotectiveness and guarding because of the history of it. So anybody really with interstitial cystitis, recurrent UTIs, all the endometriosis, sitting pain, constipation, bladder, all these are what the pelvic floor does and works. So by helping soothe the nervous and immune system about the pelvis, and then incorporate breath work to move the pelvic floor and to elevate that parasympathetic nervous system, to have optimal ability for urination elimination and achieving intimacy, learning how to use dilators. All this is within the program that can help a person reduce the central sensitization symptoms driven from that elevated oversensitive nervous system.
Great. So what about pregnant women?
So pregnant women with pain, for sure, most of my patients are postpartum that do the work, because there's a certainly, a person with pregnancy, depending on what kind of dysfunctions or feelings they're having, if they're having natural, as a weight gain with the breasts and the abdomen continue to go forward, sometimes there's a lot of pressure on the sacral joint. And so just going to a really good pelvic physical therapist can start that process of helping quickly, align that, or to teach a person what they can do for help as well. But if there is, again, there's nobody I can go to, I can't afford that, certainly can learn some of the very basics. My pelvic sense is a very basic, easy and slow start. This is not high-end aerobics or big time yoga. It's very simple, go slow, be gentle, submit kindness to yourself to allow your body to move, especially if you're going to progress with your pregnancy, to move in a way that's healthy and less fear.
Okay, beautiful. So I'm curious, so just to kind of take it a little broader, like where do you see technology, Femtech, taking and improving women's health, say, for example, in the next 5 years? Where would you like to see it too?
Yes. So we are moving forward as a society, I think, in that what can I do? Let's go back to the basics. What can I do to help myself? Right? We've been many years, and that's our training, and that's the way our society is built. We put our hands into the medical system. Unfortunately, the medical system has gotten very busy, and almost too busy. It's just the way it is, at least in our country. It's 5 to 8 minute visits with a physician, and they have to hurriedly, get through all this information. It's hard. So I think it's better if you can be a partner with your medical doctor, your medical physical therapist. Be a partner with them and use Femtech as the partnership. My guide to how can I learn to improve my wellness and health and information about that. And then I'm partnering with my medical team. And wow, you're going to have such great results by doing that approach. So I think Femtech offers the skills and the scope of how can you learn to increase your awareness of health and decrease fear. That's a big part of it.
Yes, and take it in your hands as well, or the part that you can.
Yes.
And okay, well, so I know, Evelyn, you have a gift for our viewers. Can you tell us more?
Yes. So anybody who would like, I have a free pelvic relaxation audio guide. This is one of my rewires. So you can start listening to that. I have a lot of feedback about the rewires that people have told me they immediately feel after practicing a little bit, they immediately have a sense of over them as they listen to the Pelvic Sense rewires. So please, you're welcome to have that. And just as a second thought, Pelvic Sense is, we're offering 7 days free to start our subscription. It's a 3-month program. It costs $38 a month for 3 months. That's all it is, $114. And we're offering 7 days. So both my pelvic relaxation download, for anybody who's been watching Monica's incredible Femtech Summit, she's doing an incredible work of informing and bringing great people. So enjoy and relax with Pelvic Sense.
Beautiful. So is your website pelvicsense.com?
Yes.
Okay, I'm going to post that in the comments, and also please take advantage of this gift from Evelyn. So you just, to get it right away on your phone, text Evelyn, just like our speaker's first name, to 740-908-8425, or watch out for our evening emails as well. We're going to be sharing the links so you can get it and just start somewhere. It's very important. So beautiful. Well, is there something that you wanted to end today? Maybe, with something that every woman could actually, who's watching or will be watching, that she can take today and actually do right now to help herself with her women's health?
Thank you. I think the knowledge that healing is possible is extremely empowering. That one is never stuck, even though you might be feeling where you are now, based upon the science that we know, the science of neuroplasticity, that your nervous system, immune system, they work together, and your brain can change patterns for the better, because this faulty pattern that you're in now is just, it's not serving you. So knowing that you have the ability to shift out of that, I think is very empowering. And basically, the one thing I would say to start doing that at the moment is to practice being kind to yourself. Give yourself compliments. The fact you're even on this summit. Being mindful of less criticism is a very, very big portion of healing. So.
Beautiful. Thank you so much. Yeah, just today, say something really nice to yourself. Congratulate yourself for taking your health in your hands. I definitely want to thank everybody for doing that today, who is watching. And I want to thank Evelyn. Please take a look at her offerings, because if you are not struggling with your pelvic pain, probably somebody in your circle, in your community is. And my mission is that we all spread this information and that we start to see that there's so many more solutions that we may suspect. So thank you again, Evelyn. Thank you everybody for watching. Please come back. We're going to be starting very soon our next interview. We're going on another marathon today. So it was such a pleasure talking with you, and I've learned a tons today. So and send us comments and send us questions. And I know, Evelyn, you're going to be with us for another event, Q&A today at 3 p.m. Eastern Time, or 12 p.m. Pacific. So please come back and prepare your questions. And we're going to be doing that as well for you. So beautiful. We'll see you soon, and have a beautiful day for now. Bye-bye.